Welcome, everybody. I'm honored actually to introduce our newly elected board president, Wendy Krasner, to welcome the participants tonight. So I'm going to turn it to Wendy.
Great, thank you. As Peter mentioned, this is my first official function with the public as the new president of the board of MobileMed, and I can't imagine a better setting or a better topic than behavioral health in the COVID arena. I know we have a wide array of both old faces, not old, but committed faces who've been involved with MobileMed for some time, as well as several new folks. So I welcome both our old and our new buddies. And I also, just from a personal perspective, I grew up, my father was a clinical psychologist, and my whole life growing up was the value of behavioral health and mental health services. So I personally am just very aligned with the important purpose and content and direction of the session tonight. So thank you all. And Peter, that's what I have to say to kick things off.
Thank you, Wendy. Again, we are, for those of you who don't know, we have a wonderful and diverse board. You can, several are on the call tonight, and you can check our website, but it really is an incredible board. We rely heavily on them, and the diversity and breadth of experience is really very important to MobileMed and the journey that we've been on over these last several years, but really over our 50-year history. So I think those on the call are familiar with our mission and values. I just want to remind people that during COVID-19, we live the mission and values every day, but this year, this has been front and center, every minute of every day for these last 9 months. And we are really so happy that we've got the underpinning and the philosophy and the momentum around this, because this pandemic, I think, is, of course, challenging all of us. So I just wanted to spend a couple of minutes with an overview about our COVID response tonight. And I would really encourage folks to put questions in the chat if you want to go delve into more detail on any topic. And I'm going to, which is even better tonight because I can turn the tough questions over to my incredible team of Kathy Luton, who's our clinical director, Dr. Steve Wiggins, who's our medical director, as well as Michelle, whom you've met, our development and outreach director, as well as Clara. So let's go to the next slide. One of the counterintuitive challenges about COVID as a health pandemic is that so many people are staying away from healthcare during this time. And so, COVID-19 hit in the middle of March in a big way in our region. And you can see that our volume dropped precipitously, really the last half of March, but certainly in April. And we've been looking to build that back up. Just wanted to make a couple of comments about this slide. This is actually a national experience with COVID. Primary care, private practice primary care, as well as federally qualified health centers have seen volume drop by 20 or 30% and continuing to be that low. And so, as you'll see, much of our response is looking to engage very proactively in the community. We bounced back with volume quickly in the spring, and you can see there really are let me just explain this graph. The blue are in-person care for medical visits. The orange is telehealth for medical visits, and the yellow is behavioral health via telehealth. And you see from April through October, we only did telehealth for behavioral health. And you'll also note that it was only in October that we started seeing more people in person in the clinics than telehealth for our medical care, our medical visits. And we expect that to continue to shift slowly, but we are really very pleased that telehealth is an important part of our care model. Next slide. So this is only a short list of all the ways that we pivoted with COVID very quickly. Some of these things happening within weeks of the onset in the spring. We consolidated our van sites into our fixed clinic sites, largely so we could stay really on top of things around safety measures to keep our patients safe, as well as our staff and volunteers. The pivot to telehealth, again, as you saw, was happening as early as March and in a big way in April. We've done much more in the way of triage. Phone triage when people are making appointments, both administrative people talking with patients, but also clinical people, nurses or others talking with patients about symptoms and reasons for visits and so forth. And of course, we're also triaging at the front of clinics before people enter the clinic around things like taking temperature, doing health screening, and otherwise, again, making sure that that we can keep people safe and keep serving the community. We're doing much more case management. We've always done case management. We're very proud of our model of clinical case management. We have to be even more proactive in this environment, as so many patients don't want to come in. They were anxious about the virus. They have really challenging lives that the challenges may have been amplified during the virus in terms of transportation challenges, job loss and scrambling, complexities within their family life, and the like. And so we were really we want to make sure that we are screening for people's health, but we're also screening very much for social determinants like food insecurity, housing insecurity, and all of the issues that, as you all know, are hitting this community very hard and very unevenly, and have a direct impact on health. We assigned a dedicated COVID navigator. Half of her time is spent in reaching out to patients, making sure that test results are found, positive or negative, talking with patients for positive patients, continuing to engage with them and make sure that they're following the treatment plan at home, or if need be, go to the emergency room. We have done a lot of home delivery of medications, essential meds like insulin. We've also done point of care testing at curbside at people's homes, and also to some extent curbside at our clinics. So that is for diabetics doing A1C tests, for people who have anticoagulation issues, that is another kind of test, INR testing. Really important, and really these are vulnerable patients who really benefit from not having to travel. We're really trying to stay attuned to staff wellness. This is a very difficult time for everyone. It is physically and emotionally demanding for staff in the clinic. You can see in some of these pictures, wearing a mask and a face shield, all day long, not being able to socialize with coworkers, having just anxiety with one's own families, and then having patients really being concerned about the situation raises the stress level, and we really need to be attuned to that. And I hope there's some questions in the chat and we can get back to that. And of course, we think that there's a light at the end of the tunnel, but we're not there yet. The vaccine is very important. Other public health measures are very important. But we also know that these next 2 or 3 months, regardless of anything else happening, could be the most challenging time during this entire pandemic. And MobileMed wants to keep on being an innovator and being responsive to our community. So that's a quickie, but I want to now pivot to the main of our program, which is around behavioral health. So to kick off, I want to remind people, and thank you, Wendy, for your introduction, that behavioral health has been very important at MobileMed for a very long time. We piloted integrated behavioral health over 10 years ago, and I believe we have one of the co-founders of that program on this call. So I'm going to give a shout out to Nancy Ebb, who was a real visionary as a community partner for MobileMed, as we really recognize that our primary care model should integrate both the medical components of primary care as well as the behavioral health component. And that primary care providers have a lot to do with making sure people engage around. And it sure is wonderful to have expert resources in-house as we do screening and other things. So I mentioned that medical care across the country, and at MobileMed, is down 20 or 30%. We are really glad, and it's really it's really interesting that our behavioral health visits have actually gone up during this period, and we are so thankful for that because we know the need has gone up. So this is really an issue of addressing the enormous unmet need in this community. And so we were really pleased that, as you can see, the gray bar, the in-person visits sure did shrink. And then we had two little telehealth visits in the month of March. And then you can see what happened. It just took off. We have an incredible therapy team led by Clara Painter, LCPC, who is our assistant clinical director and leading, again, behavioral health. This pandemic has shown us how vital it is. And so we're really pleased, and I'm pleased to turn it over to Clara and to share this program with you about how we're addressing these concerns in the time of a pandemic. So Clara.
All right. Well, thank you so much, Peter, for asking me to come and talk about this very important topic tonight. I love talking about our behavioral health program and how we help our patients. And I just want to start by saying how much I value being a part of mobile medical care as a clinic that really recognizes behavioral health as essential to healing and wellness. I really cannot speak highly enough to the efforts of Peter Lowick, Kathy Luton, and Dr. Steve Wiggins to create a collaborative space where behavioral health and medical providers are working together. And honestly, in this time of COVID, I feel that having this model in place put us in a unique position to help our patients. The behavioral health concerns were quickly identified and treated using this model. So today I'm going to speak about my experience as a therapist. As Peter said, I work with an incredible team. We've got 3 therapists, a patient care coordinator who kind of welcomes mobile medical patients into behavioral health, breaks down barriers, and a case manager who helps refer patients out as needed for additional services. The slide that you can see, I'm going to start by sharing some of the national trends that have been going on with mental health and COVID-19. The CDC found that during late June, 40% of U.S. adults reported struggling with mental health or substance use concerns. And this 40% number covers a wide range of mental health concerns. 31% of U.S. adults were experiencing anxiety and depression symptoms. About 26% experienced some kind of symptoms or distress related to trauma from the pandemic or other stressors from the pandemic. 13% reported increasing or starting substance use following the pandemic, and 11% seriously considered suicide. The Kaiser Family Foundation reports that mental health symptoms have increased during the COVID-19 pandemic up from previous years. In October and November, data show that more than 1 in 3 adults in the United States reported symptoms of anxiety, that 31% number, or depressive disorder. And this is up from approximately 1 in 10 in 2019, or 11%. Among adults who reported symptoms of anxiety or depressive disorder, about a quarter reported that they needed but did not receive counseling or therapy, based on the data from October of 2020. In addition, we're seeing a lot of inequities in who is affected. This pandemic is not impacting all of our communities equally. The CDC reported considerably elevated adverse mental health conditions associated with COVID-19 in younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers, including increased substance use and elevated suicidal ideation. The CDC recommends that the public health response to the COVID-19 pandemic should prioritize young adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers. And I think this speaks directly to Mobile Medical Care's mission to get care to those who need it the most. At Mobile Medical Care, we are supporting our patients in a number of ways in the behavioral health. Our patients at Mobile Med were hit with severe pandemic stressors like the rest of our nation. It's been a very disorienting and frightening time. As we found out how quickly COVID could spread, and it took us a long time to figure out how to safely protect ourselves. Our job as therapists has been to help our patient navigate these challenges. And I chose this picture with the puzzle pieces because this is just, I think the therapists are also, and all of us are experiencing the same thing. Where suddenly it felt like all the pieces of our lives got thrown up into the air. And we had to figure out how to put them back together again, with maybe children at home, needing to care for and protect older adults who might also be living with us or a part of our lives, grandparents and others. So we did that as therapists. Sometimes it meant that we needed to help a patient who lost a job connect to emergency resources such as food or utility assistance. But often it really was ongoing support that was provided to help our patients problem solve during this time of rapid and intense change. A lot of patients were struggling about managing the return to work because a lot of the people that I see are not able to stay home and do their work via video. They need to be in working retail jobs, maybe helping with cleaning essential spaces. And there were a lot of discussions around, do you have the appropriate PPE? Do you feel like you're safely able to protect yourself and your employees? Is this a job option that you can safely stay in at this time, or do you need to consider another way to make ends meet? A lot of our patients have diabetes, and that's what I love about this collaborative care model. We're working on all of it together, but this provided, additional complications. A lot of my patients with diabetes were afraid to return to the workplace. Other patients had to stay home to help with caregiving, whether they had kids at home or maybe an older adult who needed some support. And this created its own set of economic and interpersonal stressors. To talk about some of the family challenges, I would like to share the story of Irene, a woman who I worked with a few months into the pandemic. When Irene came to me, she was experiencing severe migraine headaches, a lot of pain. She was finding herself staying in bed for long periods of time, feeling anxious and depressed. Sometimes she would try to hide herself away and cry so that her children could not see her, but she was really struggling. She was spending so much time at home that her already tense relationship with her spouse was strained, nearly to breaking, and she was really questioning if she wanted to stay in the marriage. There had been some past resentments and issues, and this was building up. Irene had lost her job during the shutdown, and so now she was caring for her 2 school-age daughters at home, meeting the family needs, but at her own personal cost. When Irene came to me for therapy, we talked a lot about clarifying family boundaries, how to manage roles and responsibilities. I worked with Irene to feel secure about expressing her own needs with her husband, but while also respecting that there would be differences. What he wanted might not be the same things that she wanted, and how to manage that. We modeled some options for honest, open communication with her husband And Irene found the strength to go home and actually put these into action. And it wasn't easy at first. She said it led to some really big blowout arguments, but they found a way to express what they needed to each other. And she used techniques such as I sentences, really speaking about what she needed, how this was impacting her, and he was able to listen. They responded to each other. They were able to navigate their parenting roles. They were able to open up again to feelings of love and attachment for each other. Irene then took the same skills and worked to resolve some of the conflict with her older child who was nearing adolescence and having a lot of arguments with her. And it was really beautiful to see the change. Once these relationship issues were addressed, the headaches went away, the pain went away. She started seeming happier, more relaxed. When we created a treatment plan at the beginning of therapy, Irene said that her goal was to have peace in her family again. And she reported that she really found that. When I last worked with her, she was looking for a part-time weekend job and feeling confident that she was able to manage challenges as they came up. Another way that our therapy team supports our patients is just through very practical support. At a time when many people are hesitant to use the medical system, behavioral health is a place where we have an ongoing relationship with our patients, and we can encourage them, remind them, please, have you done your medical follow-up? Have you gotten your refills of your medication? And we're able to help them know whether the clinic was up and running, that maybe they could get medications delivered to their home. This was extremely important in those early months of the pandemic when there was a lot of confusion around around medical care and access. Also, many people are losing their jobs and entering public assistance for the first time, and this can be a very scary and vulnerable thing to experience. The relationships that we build as counselors allows us to help patients take that step of asking for help, whether they need medical insurance, unemployment, emergency food. The process of getting help is often long and frustrating as well. So we provided ongoing support to help people understand that this is nothing that they have done wrong. This is something that we are all in together, that sometimes it is our time to give and sometimes we really need to be the ones to receive. That this is bigger than them, and to help them ask for help, keeping their sense of personal strength and dignity. I found that job loss can be particularly frightening and demoralizing. I mean, clearly it always is, but I think in the time of the pandemic, it was even more scary. I worked with one man who I will call Carlos. And just by the way, when I'm using names, they're all pseudonyms. None of them are the real name. I worked with one man who I will call Carlos, who he was in his middle-aged years and had identified as working hard all his life. He was a hard worker. I started working with him when an accident had incapacitated him a year before. And so he was not able to work that entire year as he was building up his strength again. Right when he was ready to start looking for a job, the pandemic hit and he was unable to find anything. Carlos had no history of clinical depression, but as the month dragged by, he fell into deep despair to the point where he no longer wanted to be alive. I was really afraid for him. It was such a dramatic change. And I immediately referred him to Kathy, who prescribed an antidepressant. This is what I love about being a collaborative care clinic. Within a week, he was starting to feel better. Within 2 or 3 weeks, he was really back again, got the strength and energy to look for jobs, and found one. And I'll never forget when he called, his voice was so full of joy as he shared the good news. And he just immediately felt better, full of energy, and was able to feel like his old self. I think the role that we often think of therapists having is providing emotional support, and this has been particularly significant during COVID-19. At a time of increased isolation, therapy is incredibly important. Having these weekly check-ins where we can help people process their emotions, give them reminders to exercise, try new activities, keep themselves stimulated. It really is significant. Therapy also gives them a place to process their fears and worries. Grief and loss has been another very important part of our role. During the pandemic, it's often not just one loss. because it runs in families, it might run in workplaces or faith communities. And when we work with a patient who's lost someone, whether it be to COVID or otherwise, we provide a space where they can share what that person meant to them in their life and what it means that they're not there anymore. I was particularly struck when one week a patient was having her visit and let me know that there had been 3 significant losses in her church that week. A prior pastor had his virtual service. She had attended his virtual service the day before, and she would be attending 2 more virtual funerals or memorial services over the weekend. The other patients we see are those who have experienced COVID themselves. It is a true medical trauma, and we've seen various stages. Initially, they're often acute fears when they're diagnosed, and following the experience can be a post-traumatic stress response. In addition, many have struggled with long-term health impacts. I would like to share a few stories to help you get a sense for what this looked like. Mary was one of my patients called me about a month ago from the hospital. She was terribly afraid of dying. Her brothers had been telling her all week that she shouldn't go into the hospital because if she did, she wouldn't get out. And so there she was alone, afraid, with her children at home. Her husband was calling and texting her, but she didn't feel like she could really express her emotions to him because she didn't want to cause him more worry. I think this is something we can all relate to, how terrifying it must be to be in this situation and not even be able to have the people you feel closest to with you. So I was so glad that she reached out. I was able to kind of talk with her on the phone, and we made a plan to check in every day. She knew that her prognosis was good, but she still couldn't trust it. She was still terrified. So I talked to her the next few days until her anxiety came down and she knew she was getting better. And soon she was returned home. In another situation, Rachel came to me several months, I think in June after the pandemic started. She had a case, but it hadn't been terribly severe, but she was terrified that she could get it again. It was strong enough that she knew how bad it could be. And she was worried that if she got sick again, this time it would take her life. She was raising her young daughter and didn't feel there was anyone else who could really take her place. So this showed up where Rachel was still, even though she was physically recovered at this point, she was still experiencing anxiety, panic, and had fear of leaving the house. She would go to work, but she was terrified to do so. We worked together, and she talked about exercise being really important to her in terms of managing her mood and feeling better. So we made a plan to kind of amp it up a bit further. And she started walking 60 minutes or more every day. I encouraged her to walk as fast as she could or even run to get her heart pumping. And over time, just within a couple weeks, she reported a change. And within a month, she was really on the road to emotional recovery. She no longer felt afraid to leave the home. She had increased confidence in her body, in her health, and in her ability to protect herself. So I have a final case that I would like to share, Miriam, who experienced really a severe infection of COVID-19 and extended recovery. This final patient particularly touched my heart as a therapist. Miriam was a patient that I had worked with for a year prior, supporting her through some very difficult grief and loss. We had built a strong therapeutic relationship, and she was someone who really amazed me with her strength and positivity and her seemingly boundless faith and hope and down-to-earth practicality. She was raising 4 grandchildren on her own as a single caregiver. When COVID hit, she lost her job because it was at a mall and the mall shut down. And so suddenly we had to kind of work through that problem solving. How does she manage economically raising 4 kids? How does she get them onto virtual classes? Someone who's not comfortable with technology or doesn't know, she didn't have English as her first language. So I helped connect her to the school and do some other practical things to get her back moving forward. Then one day before our scheduled visit, I got a call from Patsy, our patient care coordinator. She let me know that she had been on the phone with Miriam to confirm our visit. and Miriam could barely breathe. She was in the ICU. Knowing that it was serious, I called her just to let her know we cared, but couldn't stay on the phone long because it really was hard for her to talk. Over the process of several weeks, it was one of those times when we just didn't know if she would pull through or not. Patsy would check in every so often. And that was really tough, having worked with somebody and knowing they were on the edge. In addition, I knew that her family depended on her, and the other primary support person in her system was her daughter. That was her backup caregiver. She also got sick with COVID. So suddenly the whole family had to navigate the situation and separate the primary caregivers from the children. And Miriam's oldest son kind of took over coordinating things. After several weeks, Patsy called to check in, and she let me know that Miriam had turned the corner. When we were able to meet again for therapy, Miriam was at home, isolated in her bedroom. She still had to be isolated from the kids at that point. And at this point, her needs were emotional. She needed a safe place where she could process the trauma of the COVID itself. Most of the time, she had to be the strong one. She had to make sure that her kids and her grandkids knew that everything was going to be okay. And that meant that she was holding all of these emotions from this life-changing experience of being right at the brink of death. I needed to give her the space where she could express all of that and be vulnerable, where she could cry openly, let her know how scary it had been, knowing that she might lose the ability to care for her grandchildren. A woman who had worked for so many years single-handedly caregiving needed a space to be cared for herself. Miriam's road out was not fast. It took many weeks where she still was in severe pain. It was hard for her just to walk and get through basic life tasks. However, over time, her body did recover. She really was worried for a long time about her future ability to provide for her family. And so at that point, it was just that ongoing support and encouragement day to day, week to week. It took time, but recovery happened. And when we ended therapy, Miriam was back at work again, feeling strong and hopeful. So I would like to end the presentation tonight on a note of gratitude. Working with so many people really makes me acutely aware how thankful I am to have health and to know that my family is in good health. And even more so, it makes me so grateful to be part of an organization that is working to help others who have been disproportionately hit by this pandemic. Really work with an outstanding team of coworkers, the medical staff, the therapy team, the leadership that are with us today. I think everyone here is so committed to helping every single person in our country have access to excellent health care. And so I just want to thank you for all you do to support our work here at Mobile Medical Care. And for my last slide, I just wanted to put out a reminder to take care of ourselves for all of us. This is a tough time for everybody. And remember to breathe, sleep, connect with others, whether it be virtually or not, and get out and exercise. So thank you so much. Some warning signs for the community of mental distress. If you notice people are having difficulty sleeping, loss of appetite, maybe emotions are changing, crying, not knowing why, being irritable, please reach out and encourage people. Or if you're noticing this in yourself, there's a lot of help out there now. Mobile medical care, private insurance, therapy is out there and people want to help you. Focus is on having regular self-care. Just pay attention to your daily routine, getting good sleep, attending to medical care, and maybe starting something new, walking outside, learning something that you enjoy. Thank you.
Thank you so much, Clara. It's a fabulous presentation. Thanks so much for really bringing alive for all of us some of these cases. I just want to reinforce what Clara said. I mean, she and her team are doing incredible things in collaboration with the medical side for people who have been hit by the virus, but also by so many people who've been hit by the pandemic, who've never been COVID positive, but have enormous issues in terms of the stressors in their lives, as well as in their chronic diseases and so forth. So we are really, again, very proud of what we're doing, and we're really working hard to try to be the resource that the community needs, particularly those who are really traditionally underserved in our society. So thank you very much, Clara. I know we had some questions ahead of the town hall tonight, but I'm going to again encourage people to put questions into the chat, and I'm going to turn it to Michelle, who can manage the questions between the new ones and the old ones.
Got a number of questions that came in. To start us off, besides general health, public health guidance, is there anything that you're particularly looking out for around the holidays for your patients? Clara, could you take that one?
Sure. I think something that we've really been encouraging our patients to do are find ways that they can continue some of their traditions, despite the COVID restrictions. And so finding ways to still connect with family, whether it has to be via Zoom or telephone call, maybe making a special food that really means this holiday for them, creating some kind of craft, and using this extra time that we have at home to really do things we don't usually take the time for. So maybe it is, baking a dish by hand or doing, learning how to knit or crochet, something new. So that has been one area that we've really been encouraging. Also just paying attention, special attention to asking how are the holidays affecting you right now, and looking out for any warning signs of just not seeming as engaged, wanting to isolate from others. That's been some of the work we've been doing. And a lot of people have increased their behavioral health visits, especially around this time, to get additional support.
Okay. And kind of along that line, Clara, a question in the chat was how much on average is a patient working with a therapist at MobileMed? Is it weeks, months, years?
Mm-hmm. That really varies a lot. I would say that we have a number of patients who will come in and maybe do a course of two. Some people just come in a couple of times and really need to talk about something and learn a few skills and move on. Then I would say we have another set of patients who maybe come in for 6 to 12 visits to work through a problem that is going on in their life and kind of get through that basic situation or learn some skills and take that with them. And then there are other folks that really continue on for years, who I've worked with some people for as long as 4 years at this point. And it's really lovely to see how you can start by learning some skills and then with time really deepen those skills and make some more ongoing, really lasting changes. So we really work with patients on all different levels. And that's something that I really valued here at Mobile Medical Care.
Right. Another question in the chat is, do behavioral health patients receive CIRA?
CIRA.
No, I think that was Clara. That was the Clara treatment, Michelle, I think in the chat. That was a typo.
Okay.
Clara is now she's now a formal name of a treatment.
I thought I saw a question maybe about how patients were connected to behavioral health treatment. Was that what that question was about, Michelle?
Yes.
Sure. So when patients come in, everybody is screened for anxiety, depression, trauma, and substance abuse by their medical providers. So if a patient scores positive on the screening or simply expresses stress or other behavioral health concerns in the meeting with their primary care provider, they are immediately referred to behavioral health. And that is where, if we're in the clinic, we can meet with them, just let them know who we are. And if a lot now with the telehealth, this referral goes to Patsy Wolcott. That's why I call her kind of our greeter for behavioral health. She reaches out to them, orients them, helps them feel comfortable coming to see us, and then is scheduled with one of the therapists.
Kathy, do you want to speak to that same question from the medical side, and Steve, you may want to jump in as well.
Sure. I think that it's important because many somatic illnesses are either exacerbated or the result of too much stress in people's lives. And as a result, since we have therapists that are right on site and can help right away, it's very, very helpful to have Clara and be able to go over those symptoms with her in the clinic or one of her therapists, to be able to get to the bottom of why people are struggling. So it's been incredibly helpful to all of the medical providers at MobileMed.
I got a two-part question. How has telehealth helped break down the barriers patients face to getting treatment? And once we kind of go past COVID, do you think patients would be receptive to want to continue with telehealth afterwards?
Yes, absolutely. I think this has been one of the big takeaways from this experience for me and for my teams. You saw the numbers go up, and I think part of that does speak to the increased need for services during the pandemic, but it also speaks to the shift to telehealth. So many of our patients do have barriers to transportation. Taking the bus takes a lot of time if you're also working or if you have kids at home. Also, if you have a child who gets sick or something like that, you can still maybe complete your visit via telehealth, but you wouldn't be able to come into the clinic. So our no-show rates have gone way down. It's even better because we're also at this point, because of the emergency pandemic, allowed to complete our visits by telephone. So we have some patients who do not have access to video or internet, but they can do the visit by phone, and we found it's incredibly effective. So I very much hope to continue using this, maybe in combination of in-person and telehealth through the future.
I'm wondering, while we're on that topic, maybe if Steve or Kathy wants to speak to telehealth as an important, again, mode of care for medical chronic diseases. So for diabetes or for hypertension patients.
Sure. I mean, given the initial sort of lockdown and the difficulty of using public transportation and the fear of people even coming into the clinic, initially this, the pivot to telehealth gave our patients a chance to stay in touch with us for these chronic diseases. And while a little bit is lost in the sense that you can't do certain physical examine someone's, feet or something for a diabetic, most of the time, continuity and quality has been maintained, and the patients have very much appreciated the chance to be able to check in by telemedicine.
Okay, we've got another question in the chat. Are you hearing much or seeing red flags for domestic violence, and how are those cases managed at MobileMed?
Thank you. And that is an important question. Overall, I'm getting feedback across multiple agencies right now that during the pandemic, this has been a very difficult issue to address. We haven't had very many situations where we have had domestic violence disclosed. And in general, that seems to be the case. The shelters are not full for women and children. And so I think there are concerns that women or anyone, it's not necessarily a woman, someone who is experiencing domestic violence may not have a safe place to disclose the violence if they are on a telehealth platform and the person who is potentially abusing is in the same home. So behavioral health has been working on making a safe transition back into the clinic to be able to address concerns such as these. We've gotten HEPA filters and plexiglass so that we feel that we can conduct our visits safely using, of course, as well, appropriate PPE masks. So we're hoping that will be something we can address more effectively at this time. But in general, it's been a huge concern for everyone. Another thing to know about is the Crisis Center. Montgomery County Crisis Center is an incredible resource for this, and they do provide, now they will also provide telehealth visits if needed to do screenings and can provide some transportation. But I think they as well are finding it difficult to reach out to people and actually get them to shelter at this time.
Okay, we've got another question in the chat. And it might be interesting to hear different people's perspectives on this from our panel. Has virtual treatment complicated collaboration between behavioral health and primary care providers?
I can start, but please jump in as well. I would say it has been more difficult for sure. And that's another reason that I've really wanted to get back in the clinic. We do find ways to collaborate. I'm on a weekly meeting with the nurses and the nurse managers of all the clinics and Kathy Luton. So that helps us to coordinate a bit. And we definitely do reach out to one another, the providers on our team, but it's not as easy as being in the same clinic. So we want to start going back once a week. And I found when I was able to go in last week, I had a wonderful talk with my provider about our shared patients, and it was extremely useful. Dr. Wiggins?
Kathy, do you have some thoughts from the other? Yeah, thanks.
Well, I would agree with Clara. It's always better to be in the same place, to be able to have a conversation. You know, who knew that having a hallway chat about a patient was a blessing that we weren't going to get for the next year or so. So, but to put that aside for a second, I think, and I know everybody's been talking about how great this team is, and you know, I honestly can't say enough about Clara and her team, because they really have made this integrated behavioral health process so much easier than, you know, when I tell people who are not part of MobileMed about how great it is, they're shocked. They think I'm kidding them. But the connection that we all have, not just Clara and I, but all of the providers with all of the therapists, has been so beneficial. And, you know, everybody's always calling people or texting them, asking them, you know, when can I give you a call about a patient? It's never difficult or challenging. And Clara never blows you off, and none of her therapists ever blow you off. You can always talk. And as a medical provider, when I'm dealing with someone who I'm the first one that realizes that they're suicidal, that's very comforting to me to know that I have someone to talk to right inside of my clinic to be able to care for this person immediately. And that's been incredibly helpful to, I think, all of us. Steve, would you agree?
Yeah, absolutely. I mean, in one sense, of course, it's not the same to have that person right in the hallway for a warm handoff or an informal chat. But I have found that, in agreement with you, that I'm getting more emails, I'm getting more phone calls, I'm getting telephone encounters. The communication is not suffering; it's just different. And and I think everyone has modified their ways of interacting to keep it truly integrated.
Right. Thank you. I want to be aware of time. It's 5 minutes till 8. I think we'll take one more question. And for those, if there are questions that didn't get answered, we're happy to answer those in the coming days. Give us a call or email us at giving@mobilemedicalcare.org. The last question, besides the COVID response, what are you most proud of this year in terms of program development?
I'm going to take that one. I think when this all started, it was very, very difficult to know what was going on. So I think what was helpful was focusing on doing the best that we possibly can for our employees and our volunteers. So we worked very hard to keep everybody safe. Included in that safety was the fact that we were trying to make sure that we took the employees' behavioral health concerns into effect, the stress, the burnout, the compassion fatigue, the exhaustion, be wearing masks all day. It was very, very difficult. So I consulted with Clara and we came up with a plan. And like she said earlier, she contributes to our meetings on a weekly basis at least. And what we decided was every week we were going to provide the staff with an hour of stress relief. Now that could be anything that worked for them. That could be an hour to talk to their therapist. It could be an hour to see a burnout video. It could be an hour to do anything so that they can continue to know that MobileMed is concerned about not only their physical health and preventing COVID, but also their mental health in this very, very challenging time.
I know we're running short. Steve, do you want to say about anything about any non-COVID things as well as we look back on the year? I'm thinking about some of the very wonderful HIV prevention initiatives that kicked off during this, even during this very difficult year.
Sure, Peter. It's hard to think of anything that trumps our response to COVID. It's been a consuming endeavor, and one that I'm very pleased that we've been able to handle. But we have started another program called PrEP. Some of you might know it, pre-exposure prophylaxis for HIV. It's there's a nationwide effort to try to really bend the curve on people who convert to HIV positive. And we're very pleased that we've got a program up and running now, and we're getting our first patients. We're screening everyone for HIV, and we're beginning to roll out a treatment that prevents HIV, which is really quite wonderful. So that's a non-COVID achievement for the year.
Awesome. So there's more to come. I think we should talk more about that at a future event. But Michelle, I think we're going to turn it back over to you.
Sounds good. And there is a question near and dear to my heart of how can I get involved and what would your money be used for? So I thank you, Amy, for that question. I love that as a development director. But people can be a lifeline for our patients. You've just seen and heard from a number of our staff sharing our patient stories. And there's many more besides that. Counseling visits, for an example, cost us about $50 for each one. And you heard from Clara that we could be working with that patient for weeks, months, years. We can always use people's help with their time and talent. We're always looking for volunteers. In addition to financial support of cash, well, we have needs for in-kind items too. Those physical items that maybe people want to donate. We're trying to get as many pandemic supplies out to our clients as possible. So those hand sanitizers, those disinfecting wipes, masks, gloves, feel free to send those our way. Of the highest priority is our need for thermometers. As kind of a pricey item that you might not have in your medicine cabinet, particularly if you are really struggling here in Montgomery County. So think of that. Your support, we will go to this fine work. A lot of it is COVID response related, as it sort of has embodied all that we've done. And you can rest assured that about 85% of every dollar goes towards program services. Also, I would not be doing my job if you do have people that are kind of thinking about supporting MobileMed for the first time. The CARES Act did incentivize folks to for some further tax deductibility. If you do itemize, that adjustment is up to 100%. If you do not itemize, up to $300, and of course, consult the IRS for more details or your financial advisor. Donors that are 70 and a half or older can also donate their IRA distributions as a charitable gift. But all support is welcome, and really thank everyone for attending this evening. If you did like the presentation, we will be having more in the future, and wanted to also alert you to Kathy Luton, our clinical director, will be speaking about our colorectal screening program with the American Cancer Society next month. So let me know if you would like an invite to that. And Peter, do you have any closing words?
Well, just in closing, I think, look, this pandemic has really demonstrated, first, it really is a huge health crisis, but it really demonstrates also the extraordinary disparities in our community and how much it takes a community to address and mitigate on those health disparities. So if there's a silver lining from this pandemic, and it's sometimes really hard to find a silver lining, I think that the greater awareness of all of the social determinants that are driving healthcare in a very real way are so much more apparent to people, and it's so much more apparent that the health of our neighbors contributes to the health of ourselves and our families. And so I hope that that's a lesson that continues, and that we move past this pandemic sooner rather than later, but that we remember these lessons, and we really do appreciate your support as MobileMed continues to try to make a huge difference in our community, improving the lives of really some of our most disadvantaged neighbors. So thank you so much for taking your time out tonight and joining us. I want to again thank our team and certainly Clara and the behavioral health team, but the entire MobileMed team, but all of the supporters and stakeholders and community partners who are part of this call and who are part of greater MobileMed. Thank you, and have a wonderful evening. Happy holidays, and please have a happy and very healthy 2021.